Alright, another major concern which most men in the world face is erectile dysfunction. Now, erectile dysfunction is a type of sexual dysfunction, which means that men are unable to develop and maintain an erection on sexual stimulation. Therefore, this is something which affects not only the men but also their personal lives. It affects their confidence levels, it gives them a lot of stress. So erectile dysfunction is one of the major problems that needs to be tackled. Up till today, most common therapies for erectile dysfunction include the usage of medication, like Viagra for instance, and also there are certain procedures that can be done, surgical procedures included, which may be able to rectify the cause of erectile dysfunction, but it is not at a point where the results are still not good enough. So we have not obtained good results. Erectile dysfunction, of course, can be caused by multiple problems. Some of them include emotional problems, hormone imbalances, stress, chronic illnesses such as diabetes, high blood pressure. So all this can contribute to erectile dysfunction. But erectile dysfunction can also happen for somebody with no other major concerns, simply because of emotional imbalances or hormonal imbalances, and this can pose a major problem or a major change for this person's life. Now, how are we using stem cells to treat erectile dysfunction? Two things. Number one, stem cells can correct the underlying problem which causes erectile dysfunction. For instance, diabetes, stem cells can correct diabetes, which will in return help to correct erectile dysfunction. Or cardiovascular, blood circulation related. So if our blood circulation is improper, stem cells can correct the blood circulation, which in return will correct the erectile dysfunction. At the same time, erectile dysfunction means that the circulation or blood flow to the penis is not proper, is not good enough. The penis is either not receiving enough blood or it's unable to keep the blood for a certain amount of time. Therefore, two parts are very important when it comes to developing and maintaining an erection. The first part is the relaxation of the muscles. The second part is the blood flow. So these two work hand in hand. When the penis muscles are relaxed and when the blood vessels are constricted, the erection will form, will develop, and it has to be maintained. Now, when we administer stem cells, mesenchymal umbilical stem cells, directly to the penis, now this is a direct injection, what we can obtain is something called angiogenesis. Angiogenesis is basically the formation of new blood vessels via mesenchymal stem cells. So if new blood vessels are able to form around the penis, it will only enhance the blood circulation towards the penis. And at the same time, like I mentioned before, there will be regulation of the soft tissues as well. Therefore, the erection will be much better, it will last longer, and it will also be stronger. So these are the kind of things we can obtain using direct injection of mesenchymal umbilical stem cells to the penis, as well as intravenous to correct underlying problems for erectile dysfunction.